G'day, and welcome to the Australian Health Design Council podcast series, Health Design on the Go. I'm your host, David Cummins, and today we're speaking to Mignon Stapelberg, who is now the Director of Health and Infrastructure at the Department of Health in Western Australia. We welcome Mignon to talk about Western Australia, health, infrastructure, and the challenges that WA face, while also the opportunities and success that WA have had over the last few years. Welcome, Mignon. Thank you for your time to be here.
Thanks, David. It's good to be here.
I, like many people, love Western Australia, love Perth, love everything to do with Western Australia. Very, very jealous of your weather in winter or perceived winter over there. It's such a unique part of not only Australia, but the world. How does Western Australian health infrastructure deal with the vast majority of the state being so large?
Yeah, thanks, David. And that is indeed a challenge, especially when it comes to our country health. And there's never enough money and always too many priorities. But yeah, I think it's just for us going through a process of prioritization when it comes to investment and infrastructure and ensuring that we look at it from all different angles and not only trying to target a large part of our population, but also on ensuring that we provide services closer to home. So in looking at our infrastructure, we always try and really prioritize based on a number of things in terms of where our dollars goes. And yeah, for country health, that's particularly important.
Yeah, and when you talk about country health, I know you've got WACS over there for Western Australian Country Health Services, where pretty much literally your project team, builders and designers must travel hours and hours just to get to site. So that's another complication as well, isn't it? That project coordination.
Yeah, and with the current pressures in the construction market, getting builders out in the regions has been really hard. Had to retain certain projects on a number of occasions because there's just not that many people interested in going out to country and delivering and they and try and make it attractive for the construction companies to go out there, i.e. bundling certain projects to see whether that attracts some more interest from the market. And of course, what we thought projects would cost 3 or 4 years ago is no longer relevant. So ensuring that we've got sufficient budgets to attract those companies to go out in the regions is really of significance for us.
And just excuse my ignorance here, but would I also be correct in saying there are some areas in WA where even the technology just isn't up to scratch with what you need to be designing infrastructure and for user groups and planning? Or is the ICT relevant enough and strong enough that it's not an issue anymore?
No, definitely a gap in certain areas. Again, pretty costly, a lot of need in the digital space, only limited dollars available. In WA, we've got a digital capability fund that government has set up. It's a bucket of funding across government for a certain number of years, and all agencies have to apply through that process. And the digital government or DigiGov that we have in WA then makes those calls in terms of priorities. And we've been lucky enough more recently in WA to get some support for funding specifically on electronic medical record systems that will be rolled out across the system, for new HR systems. But I mean, the need in terms of ICT in general is massive and it comes at a price. And I guess for us also, when we do our business cases and PDPs, is really just to, from the beginning, ensure that we get the digital design and input from our ICT guys done properly rather than just applying like a percentage. Because what we used to apply in terms of business cases for that ICT component in the past has obviously significantly changed. So hence we try and get those ICT architects and engineers in really early in the piece to be part of the design and business case development.
Yeah, how interesting, because most companies would do their own business case with a standard percentage that may be relevant to metro versus country. But even just thinking about it gives me a small headache because the level of complication with that vast majority of geography, if you don't get the figures right, then the business cases goes out the window. So how much due diligence goes around those business cases? Because the mind boggles with some of the areas that you have to provide care for patients?
In the past, it was just a percentage, and especially, I guess, when you do the smaller projects, it's okay. But it's when you start doing the larger, currently at WA, we've got quite a bit happening in the infrastructure space. We've got a new women's and babies hospital um, that's currently in the stage where we are finalising the PDP to present to government with the EOI out in the market. We define major projects as over 100 mil, and we've got 5 of them going at once. It's the new women's and babies. There's Bunbury Hospital. Um, there's Geraldton Hospital redevelopment, both of them obviously in country. And we've got the Greylands Old Mental Health Hospital that's in desperate need of a redevelopment. And then we also have Peel Health Campus that is about to undergo a significant redevelopment. So 5 major health projects, first time since we finished the Perth Children's Hospital and Fiona Stanley. So 2 big hospitals that was done quite a few years ago. I think it was around about 16, 17. Perth Children's was done and Fiona Stanley just before that. So I haven't done major projects for quite some time. And just to go back and see how the business cases for these projects was done back in the day, and now when we go to PDP to revisit after quite a few years, ICT and design that goes with that has been quite interesting, and definitely the amount of effort put into ensuring that what's in the PDP is correct has been significant. But it's also to get the right resources in the market to be able to input into that, I'm going to call it ICT architecture, for a better word, it is quite hard because there's not many of these people around that has the expertise, but definitely significant effort to try and get it right rather than just a percentage being applied. So yeah, ultimately we get investment decisions made based on business cases, and obviously then there's a number out there that you get held to account as government, and there's an expectation that you deliver the project within that budget envelope. So really important that we do get it right from the beginning. And definitely what I've seen here in WA for our major projects is that we don't just apply a percentage anymore. We scope it out and ensure that it's part of that design process.
Yeah, it's really positive to hear, and I think it's certainly best practice these days to be able to do that due diligence correctly before the business case is set up. You just mentioned 5 major projects that that are happening in the state of WA. Like, how big is your team? Because that's a lot of projects for what I can imagine isn't the biggest team in Australia. Would that be correct?
Yes, our team is pretty small. I joined the infrastructure unit here in the Department of Health 2 years ago, and we were only 12 people. We are now 40 as the system has grown and all these projects have just come online. How we are set up in Western Australia is quite interesting. So we have, similar to some of the other jurisdictions, we have the Department of Health that acts as the system manager and provides that oversight on behalf of the Minister, Director General. And underneath the department sits each of the health service providers: North Metro, South Metro, East Metro, Country Health, as we've spoken about before, and a few other, child and adolescent, pathways, our pathology, and them each being managed and overseen by their own boards. They are accountable authorities in their own right. And there are certain projects that the Director General then delegates out to the health service providers to deliver on behalf of the system. Typically how it works in Western Australia, all works over $2 million, actually gets delivered by our Department of Finance, who's our delivery agency. So we are the client, Department of Finance delivers, and obviously engages the construction companies and whoever else that inputs into the process. So ultimately, agency, we start developing a business case. As soon as we get the funding in from government, we hand it over to our colleagues in the Department of Finance, and they then start working through the PDP process with input from the clinicians across the system. And from there, obviously, the process happens. So that's typically how we do it in WA Health. As of today, 106 projects on the run, which is a lot. And as I say, they do vary from a couple of mil all the way till I think our Women's and Babies currently funded at 1.8 billion and have just recently moved from one location to another, which is quite interesting and involved quite a bit of work. And just given all the delays that we are currently experiencing in terms of projects just due to rising costs and of course COVID that's happened and unfavorable tender outcomes and having to kind of rethink and change that, it's been quite challenging. And then of course obviously with worker shortages and material scarcity, like everything just adds to the timelines. And we've got obviously from political point of view having to deliver on projects. It's just the competing worlds of what the market can do, but what we as government want to deliver. And then, especially as you can imagine, I'm sure I've heard from other jurisdictions, just in a 24/7 environment, and most of our work's happening on brownfield sites, and you just don't know what you're going to discover until you go in there, has been challenging.
Yeah, I always say it's exciting when you discover surprises. You can only look at it positively. I choose not to look at it negatively because otherwise I wouldn't enjoy coming to work, which I tremendously do. I know the state government has been prioritising over the last few years mental health. I think it was maybe 8 or so years ago, there wasn't as many beds announced in the budget. And so I know they've tried to rectify that as a whole state. So that's something you've been helping out as well with building new mental health facilities, correct?
Correct. And it's definitely been a focus of our government. We've got quite a few projects that's adding capacity in terms of new mental health beds in the system. We've got Fremantle Hospital, that would be a new 40-bed mental health unit. We've just recently finished Joondalup Health Campus. I need to check the number of beds, but that was quite a bit. Brand new mental health unit, had quite a few interesting bits of work around specifically doors for that campus, which I think a lot of the other facilities have learned from. We've got Greylands, old mental health hospital, that's undergoing significant its planning works for now, specifically around forensic mental health beds. And then we've got Bentley, a secure unit with another 24 beds. That's happening over the next couple of years. We've got some mental health emergency centres. That was part of our election commitments in both Armidale and Rockingham. It's been a bit challenging in terms of design because they tend to link onto some much older emergency departments. So that comes with, I guess, if you can imagine, quite a bit of, again, complexity. But as you say, it keeps it interesting. So that's good. And then, as I've mentioned before, some of our developments out in country also has a number of mental health beds attached to it. Yeah, that I think I've covered most of the mental health beds. There has been and will continue to be quite a bit of focus in that space, which I think is definitely necessary.
And I know we're running out of time, but WA as a whole is obviously Australia's biggest state, and there is a strong contingent of Indigenous communities within Western Australia. How does connecting to country, design, construction, even user groups and consultation impact the department when it does come to designing and building for Indigenous communities?
Definitely from our end, it's to continue to focus on the consultation and not just as a tick box exercise, but real consultation with the right people out in the community and really listening. Again, not just going out there for the sake of going out there, but really learning from those consultation sessions. And I think it's been super valuable. I know more recently we've done a bit of work at the Bunbury Health Campus, and yeah, what we got from the community through that process has been amazing.
Yeah, I think it's something where certainly you would be well, and NT leaders in Australia with that consultation. Every design I've seen over in WA, some of the most beautiful architecture I've seen, to be brutally honest, and some of the buildings is phenomenal. But you can always have that sense of consultation with Indigenous communities because it is very prevalent and obvious, more so than I would argue in some of the eastern state hospitals. Happy to be corrected if someone wants to challenge me, but that would be my experience. And I'm pretty sure I'm right there as well. Just before we go, just final question. What would be a take home message for listeners who are wanting to do bigger projects, over 100 million for the state government? What is something that they should be looking at, learning from, trying to incorporate into their bigger projects when it does come to especially designing in Western Australia?
Proper planning. I think for me is we tend to want to just get a project across the line in terms of funding, but really important that we, yes, I always call it the 5 P's: proper planning prevents poor performance. And really, if we put the effort in the front end, the rest will go easy.
Yeah, I always say 90% planning, 10% execution, and you can never go wrong with too much planning. But I'm sure we've all got examples of projects that have been rushed without the correct planning that have not been maybe as successful as you would like them to be. So I think it's really good advice. Mignon, I just want to say thank you so much for your time. I know you've been with the department for over 10 years. I think it's people like you who are consistently there to help the department, to help the community, is why WA Health is so successful. The projects over there are literally mind blowing, and I'm so in awe every time I go over there to just look at those projects. I'm almost positive that's not only so part of you, but certainly your team's contribution to WA and health infrastructure. So thank you so much for your dedication to this industry, and keep up the good work, and good luck with your future projects.
Awesome. Thanks, David. It was lovely to meet you. And let us know when you're over here, and I will show you the next best thing.
You have been listening to the Australian Health Design Council podcast series, Health Design on the Go. To learn more about the AHDC, please connect with us on our LinkedIn or website. Thank you for listening.